still off too. You can see it. Turn your head this way for me. And the opposite. Back to the middle. What we're finding is that it's not necessarily coming from the knees, but the knees are a result of the body being off for so long. So what we're trying to do, or what we're doing, is giving good adjustments to realign the spine, take the pressure off both knees, bring balance back to his body. Because he's a soccer player. He's scoring, he's kicking goals, he's training. He needs this alignment. Lift this leg up for me. And the other one, please. Good. A little harder on this side, wasn't it?
Yeah.
Lift up now, please. That's better?
Yeah.
Awesome. Tight in here, isn't it? Deep breath. Let it out. Good. Now we're going to his favorite one. Lay on your side facing me, please. Yep, come a little bit. Yep, perfect. Pull that arm out. Roll it over. Bend this knee. Bring that arm over here. Thank you, sir. There we go. That's that face right there. That's when I know I got it, okay? No, he always does this, like do the other side, but there's no need, okay? He's doing just fine. Come on up, David. We good, man. We good. Like you're done. Yeah, come on up. He wants some more, right?